I would start the the discussions based on what Dr. Lal said just now. But at first, a very broad question. We have Meena from home care. We have Dr. Raghuvanshi from the deliverer side. We have got Rohit Sathe from MedTech. So we have a very variety of top leaders in Indian healthcare here. What is the impact? It's a broad question, so please choose to answer in your own way. What is the impact on hospitals, on diagnostics? On diagnostics, I'll come to you, Dr. Lal. Diagnostics, medical technology, healthcare, home care companies. It's a very broad question. I think your experience that you can share with the audience would be of immense help. So, Meena, you want to go ahead? What has been the impact on home care companies the last couple of months?
Sure. Good to be part of this webinar, and thanks, Anjan. Good to see you again, even though virtually. Immediately after the lockdown started, obviously there was a huge impact because any kind of healthcare that requires people to move around is obviously massively impacted by such things such as lockdown. So the first 2-3 weeks, it took us to sort of figure out how do we go around this when people, even though the government has said that healthcare workers will move, it's not necessarily something which immediately gets translated to the ground. So the first 2 weeks were pretty rough, but soon we sort of figured out how to continue to provide services. One of the things that works in our favor as a home care company, we can provide those services which require for the helpers or that is the nursing attendants or the nurses to actually stay in patients' homes. So we quickly moved into stay-at-home model for as many of the services that we could. The things which are more require people to come and go, such as physiotherapy or doctor visits, etc., obviously took a big hit. So that was the immediate impact. But thereafter, some very interesting tailwinds have started to emerge. First and foremost was that the moment teleconsulting guidelines were offered, then we were able to quickly put together a teleconsulting offer, which we already had, but it was possible for us to move that much more quickly and rapidly through our entire existing ecosystem of patients. And we have served about 8 lakh patients today. So even just reaching out to them and saying, do you need a support now because you're locked down, you can't consult your doctor, can we help you, itself was something which gave us a quick upswing. The other things which are very interesting tailwinds which then came are things like a lot of pharma companies, for instance, approached us and said that our patients are not able to go to their clinics and to the doctors to get the ongoing therapy. How can you help on the ground? So that was a quick immediate requirement, and we started to move. And even to the extent of some of them saying, can you provide a complete chemotherapy solution at home for those who've already done a few cycles? Can we do that? Now, some of these tailwinds started to move, and that has, and of course, as the hospitals open up, our business has also grown. The other piece, which is absolutely new and which is very important to what our own role in the whole COVID management situation is. And towards middle of April, we started to speak with some of the governments. And in fact, with the Delhi government on 4th of May, we started working with them to support patients who are home isolated. Okay. So we put together a complete remote model of monitoring these home isolated patients for Delhi, and then a few other states we have since then started. At this point, we support nearly 8,000 home isolated patients, monitoring them on a daily basis, seeing how their health is, if they have any health issues, providing them with a doctor teleconsult, and if things are worse than just a teleconsult, working with the local machinery and moving them into hospitals. In fact, in Delhi, 93% of the people that were on home isolation have been kept at home. Only 7% needed to get any kind of escalation which required hospitalization. So from a impact on the ground, it has been very substantial because all these people did not have to go to a hospital. And like Dr. Lal was saying, the hospital infrastructure is already struggling so much. So being able to support in this in some fashion has been very helpful and satisfying.
Thank you, Meena. I just want to ask, one more thing to you.
Sure.
Two things, in fact. One is in the lockdown situation for more than 2 months. How did you? I mean, you must have faced a lot of challenges in having your people go to the home, etc., etc. So, any quick comment on that? How you managed
Yes.
to overcome that? Yeah.
Absolutely. The first 2 weeks, like I said, Anjana, was absolute chaos. We didn't know what to do. We tried to send with a pass, no pass. How do you get all that? So those were
Sure.
very,
Exactly.
very challenging times. After that, things have kind of settled down into a decent routine. What interesting thing also is that because there is a lot more of worry about letting people into your homes to help seniors or sick people, the patients are also looking for more organized players rather than
Sure.
taking your local service providers. So, in a way, it works in the favor of those who are organized, who have got great quality, who can actually show that how we take care of our people. So, from that perspective, it helps. Certain things, certain interesting innovation that came in, for instance, physiotherapy. Throughout the lockdown, obviously, there was none, but we started to do video-based consulting for a lot of our patients, and that was something that they really appreciated. And now going forward, what we are offering is a mix of both. We can do video, we can come to you in person. Let's have a mix of both of those. So it helps us innovate and come up with new solutions.
Sure. Sure. Thank you.